Hello, everyone. Welcome to the October 1st monthly chat on kidney disease, what you should know. Next slide, please. My name is Alicia Chowdhury, and I'm the Outreach Director for the Bruin Beads Health Club, an undergraduate organization that partners with Dr. Anjay Rastogi and the Core Kidney Health Program here at UCLA Health. Being part of this community has been one of the most meaningful aspects as my time as a student. What makes Core Kidney so unique is that it does not treat healthcare as something abstract or removed. It actually brings the human experience to the forefront. It centers real people, and those people are patients, donors, and caregivers. And it asks, how do we make their voices heard, but also truly valued? In my role as outreach director, my goal has been to make that question actionable. I've worked to connect more students to Core Kidney's mission by spotlighting stories that show the heart behind medicine, specifically kidney health. Whether that is through social media campaigns, reels, or organizing speaker panels, my focus has been on building bridges between clinical and the lived experiences of patients. Next slide, please. As always, we embody the core values in all the work that we do. CORE specifically stands for clinical excellence, outreach, research, and education. Next slide, please. Here, I want to take a moment to highlight the people who make all of our outreach possible. The Core Kidney Ambassadors. These are kidney transplant recipients and living donors who have chosen to give back by supporting patients and their families facing challenges of kidney disease. Their lived experience allows them to connect on a deeply personal level, offering not only guidance, but also hope and inspiration. Next slide, please. Specifically, the undergraduate chapter of Core Kidney is the Bruin Beads Health Club. We are a group of hand-picked UCLA students who are passionate about making a difference in the field of kidney health. Through our partnership with Core Kidney, we are able to provide students with opportunities to directly support a community of healthcare providers, staff, patients, and their families. Our work ranges from raising awareness about kidney health and disease to helping organize outreach events, patient summits, and educational programs. At the heart of what we do is the commitment to bridge the gap between students and the wider kidney community, ensuring that our generation learns not only about the science, but also about the human stories behind kidney disease. Next slide, please. As outreach director, I've had the privilege of planning and coordinating many of our successful initiatives. Here at Bruin Beans, we lead outreach initiatives across the greater Los Angeles area with a special focus on underserved communities and organizations. Our mission is not to just provide resources, but to create a lasting impact. Through our collaborations with Core Kidney, we've been able to expand community health programs and connect people with vital resources they might not have otherwise had access to. At the heart of our outreach is a commitment to empowering patients, helping them feel confident and advocating for their own health. We put this into action through a variety of programs and events. This includes our upcoming patient summit, which I will debrief later in this presentation, also our annual service trip to Tijuana, and our high school outreach program, and obviously plenty more. There are so many outreach events, I could not just fit them all on this slide, but I would like to highlight them nonetheless. Next slide, please. This is a disclaimer for our program. Next slide, please. Now, let us begin the educational portion of this webinar. It is my pleasure to formally introduce our speakers for this evening. They bring a wealth of knowledge and experience to share with us, and we are very excited to learn from their insights and expertise. Next slide. One of our speakers tonight is Dr. Sean Lay. He is a board-certified physician in internal medicine and happily one of the newest faculty at the UCLA nephrology team. He earned his medical degree from Temple University School of Medicine in 2020, followed by his residency in the internal medicine at the University of California, Irvine Medical Center, which he completed in 2023. Dr. Lay achieved a board certification from the American Board of Internal Medicine in 2023 as well, and is now completing his fellowship training in nephrology here at UCLA. His dedication to advancing kidney health and improving patient outcomes has shaped both his clinical work and his academic pursuits. We are very happy to onboard Dr. Sean Lay and have him speak this evening as well. Next slide, please. Alongside Dr. Sean Lay this evening is Dr. Michelle Hwang. She is a board-certified nephrologist who practices in Torrance, California. She earned her medical degree from the Chicago Medical School in 2015 and went on to complete her residency in internal medicine at Huntington Memorial Hospital in 2018. She then completed her fellowship in nephrology at UCLA in 2020, where she also served as chief fellow. Dr. Hwang is certified by the American Board of Internal Medicine in both internal medicine and nephrology. Her clinical interests include, but are not limited to, hypertension, chronic kidney disease, kidney transplantation, and preventative nephrology. She is fluent in Korean and Japanese, allowing her to connect with a diverse patient community. Both Dr. Michelle Hwang and Dr. Sean Lai have collaborated thoroughly with Core Kidney and the Bruin Beans Health Club, and we are very excited to see what they have to share this evening. I will now pass it on to them both.
Thank you so much for your warm introduction, Alicia, and thank you for everyone for attending. My name is Dr. Lei, and I'll be giving the initial presentation. To start, I wanted to like to talk about our kidneys. And we have two kidneys, one on each of our ankle regions, and blood is continuously delivered to our kidney through our artery every single second. And we're sending our metabolic product of our day-to-day life for removal. To do so, the kidney receives roughly 200 liters of blood. On average, each of us have about 5 liters of blood, and our kidney every single day filters around 40 times of the blood. And it efficiently resorbs the important electrolytes while concentrating the waste product to be excreted into our bladder and ultimately come out as urine. This process continues every single second and responds to the changes in our lives, such as diet and our lifestyles. To be more in depth, what do our kidneys do? The kidney function can be simplified into a few categories. It removes waste product for our daily metabolism. It balances and maintains our fluid and electrolyte intake into a very specific range for our ideal body function. It senses and responds to disturbances in our hemoglobin and our bone health through hormonal regulations. And it maintains our blood pressure throughout the day and night in coordination with other organs, whether we're actively exercising or sleeping. And we're going more in details in the upcoming slides. In the event that is out of our control and our kidneys are functioning less than it should, what should we know? We physicians examine our patients and perform necessary blood and imaging tests to help us narrow down the cause of kidney dysfunction. If you can find the cause, stop it and prevent additional injury from occurring, and with enough time, we hope the kidney will recover and go back to how it was. We also try to find the contributing factors. What are the circumstances or the risk factor that led to the disease? And how can we remove or lower these risk factors for kidney diseases? We also have to think, is it familial? There are things we can control, such as our diet, following up with our appointments, but there are also things that are outside of our control. As research advances, we're finding more genes that predispose us to kidney disease or progressing our existing kidney diseases. Genetic is a powerful tool that can give us more information to analyze these risk factors and give us insights to possible impact that it can have on our future health and for our children. And do we have the right team? I believe in the mantra that it takes a village. The kidney is such a complex organ and it works in unison with the rest of the body. To help with our overall health, we have to take care of our kidneys and our other organs. And over time, our team members might increase to provide that additional expertise to cover these complex facets. We should be involved. We work together to tackle a problem. When we understand the situation, it provides with the awareness and the ability to improve our health. To understand the decision we make have an impact, whether if it is changing our diet, measuring our weight or blood pressure, it provides us the ability to manage our health and track our progress. In addition, we have to be organized. As our scope of care broadens, introducing new team members and physicians, not only do we have to plan for our day-to-day life, we also have to remain organized and follow up with appointments and testings. To monitor kidney function, we order a slew of blood and urine testing. Commonly, blood or serum creatinine is ordered to monitor our kidney function. And what is creatinine? It is a naturally produced metabolite from our muscle, and it is almost exclusively removed from our kidneys. When our kidney function declines, less of the creatinine is able to be removed by our kidneys, and more of it accumulates safely in our blood. This change in creatinine can be measured by blood tests and allow us to track the kidney health over time from prior baselines or reference points. However, creatinine is a number, and often we communicate to our patient what the percentage of the kidney function is via a number called GFR or glomerular filtration rate. GFR is an estimated calculated from creatinine. Hence, creatinine and GFR is intrinsically linked with each other. And with that, it can provide us with information to monitor our responses and our treatment course. We also commonly order urine testing. As urine is produced from the kidney and travel through the ureter and bladder, it gives us the additional information on kidney health. Frequently, we test for proteins and or albumins to see if there's spillage of protein from the kidney as a marker, but also as a tracker for kidney disease. Imagings such as ultrasound or CT, it can be helpful to provide us an indirect visualization of the kidney, its location, its size, its shape. It can also localize any abnormalities that cannot be seen on a blood test or urine testing. And sometimes, despite all the information we gathered, we have an idea what the disease can be, but we're not certain. To have a better understanding, we had to perform a kidney biopsy. We had to take a small sample from the kidney and look at what we're dealing with on a microscopic level. And there are many, many ways that kidney disease can develop. And we often can categorize it by time or by other metrics. By time, we can classify injuries that we found that are immediate as acute, investigate it, and try to reverse the injury and recover the kidney back to normal. But when the disease persists for multitude of reasons, whether it persists in difficult to control diabetes or, unfortunately, a very severe case of kidney injury, the nature of the disease can become chronic. And often we describe it as chronic kidney disease or CKD. To provide an idea to the severity of the staging of CKD, we can categorize it into 5 different stages by GFR, again, calculated from the creatinine. But it is important to know that the staging of CKD is for patient who has been diagnosed with kidney disease, and is used to classify the disease by severity. The first stage, or stage 1, start with a normal GFR. As the disease progresses, as the disease and the GFR decreases from 60 to 89, stage 2, 30 to 59, stage 3, 15 to 29, stage 4, anything below than 15, stage 5. Often, CKD staging unfortunately provides an unnecessary stress to healthy patients when with healthy kidneys by the basis that their GFR was classified under CKD stage by their GFR alone. To focus on the stage, as again kidney function declines, we progress from the CKD stage from stage 1 to stage 5. And stage 5 being the highest stage, it conveys the most severe dysfunctional kidney. And patient may feel ill from dysfunctional kidney and may need help with kidney replacement treatment or dialysis to fill in the gap that the kidney is not able to perform. The CKD staging is a powerful tool. It can provide us and with the patient an idea of what the current kidney health is and allow us to see and plan for the future. And if we will be able to step back and see what we can do to minimize disease progression, we always start with prevention, such as blood pressure control, diabetes management, as they are the risk factor to development of CKD. If we can minimize and control them, we can prevent the development of CKD. If CKD was to develop, we track the diseases, provide treatment plan to slow down the disease progression as much as we can. And depending on the abnormality, we expand our team to include dietitian to provide the education diet that can help address these abnormalities. Our is to maintain our kidney as healthy as we can. But sometimes, despite our best efforts, kidney disease can progress and can reach end-stage kidney disease or ESRD, where the kidneys no longer has enough function to maintain our day-to-day life. At this stage, unfortunately, kidney replacement treatment is needed, such as dialysis or kidney transplant to address these abnormalities. Advances in research have provided us with more and more tools than before to help us address kidney disease at different stages. And hopefully in the near future, we'll have more tools to help us slow down kidney disease progression and perhaps even to prevent it. There are many ways kidneys can be damaged, and to talk about a few. Hypertension or high blood pressure and diabetes are well known and well researched to show that it can damage our kidneys slowly over time. Controlling blood pressure and diabetes are thus very important to minimize its injury to the kidney. Drugs, either prescribed or recreational, can have negative effects on our kidney depending on the circumstance, such as long-term usage of over-the-counter NSAIDs for pain relief can lead to kidney injury. Specific herbal medications, such as the commonly used tea that contains aristolic acid, can lead to kidney diseases with long-term exposure. Excessive protein supplementation, in case with patients with underlying protein leakage, can further exacerbate the disease, increase the protein leakage, and unfortunately increase the kidney injury. Infections such as HIV and hepatitis can either directly damage or indirectly damage the kidneys as well. Immune dysregulations. At times, unfortunately, the immune system that are designed to protect us attack our own organs and can attack our kidneys and lead to injury. As we talk about so much about what can lead to kidney diseases, what are the results of kidney disease? As our body and organ work in unison, disruption in one organ can lead to disrupting other, and we'll go over the details in the following slides. Kidneys connected with our bone marrow for hemoglobin management. When the hemoglobin is low, the kidney detects it and sends a signal or hormone called erythropoietin to the bone marrow to stimulate it and increase the hemoglobin production back to normal. When the kidney health unfortunately is declining, less of that signal is able to be produced and less of it is able to stimulate the bone marrow. And as a result, patients may develop low hemoglobin or what we call anemia. Kidney also controls our calcium and phosphorus balance. which is important for the long-term bone health. The kidney does so by sensing the level of calcium and phosphorus and regulates calcium and phosphorus absorption or excretion depending on the circumstances. As our disease can progress, the ability for our kidney to remove phosphate from our diet or the ability to absorb calcium from the diet becomes impaired, leading to high phosphorus or low calcium that can be detected on our blood test. As a result, our body senses this imbalance and trying to fix the abnormality by regulating hormones and increasing them, such as the parathyroid hormone. Long-term high levels of parathyroid hormone can unfortunately weaken our bones. And depending on the level of dysfunction, we try to address it by either providing dietary educations on low phosphorus diet or adding phosphorus binder that can decrease phosphate absorption in our meals. And we also test for other hormones in our body, such as vitamin D, to see if the patient needs supplementation to it as well. One of the main functions of the kidney is to remove acid produced from the metabolism. And to measure acid, we indirectly measure it from our blood by a test called bicarbonate level. And depending on the level, we can help and supplement bicarbonate to increase the level or to modify a diet to lower the amount of acid that is in our diet. The kidney is a key regulator in potassium balance. Most of our potassium intake are removed by our kidneys. As kidney function becomes severely impaired, the ability for the potassium removal is as well. We had to lower our potassium intake to reach the same level as our kidneys able to remove it. If there's a discrepancy and there's more intake in potassium than ability for our kidney to remove it, over time, it will slowly accumulate and build up, and we can detect it as high potassium. We can try to add diet restriction, try to lower the amount of potassium that we are taking in so we can compensate for the lower reduced kidney's ability to excrete it. When it is not enough, we can add in potassium exchangers, trying to extract potassium from our bloodstream through our bowel movements. And excellent. So there's a question to talk about what does a low potassium diet look like? And what are some high potassium food we should avoid? So generally, simple things are the great things that I enjoy. Avocado, bananas, or those really dark green vegetables, broccolis, or kales, they're very high in potassium. And often we recommend a patient to be established with a dietitian so they can look into their daily diet and see what are things that are considered low in potassium and they can supplement it to have more potassium in their diet. And also identify things that might be hidden, that might be have high amount of potassium in which we should cut down. Maybe we don't have to skip it entirely, maybe just cut it to every other day. And then we can monitor the progress and see if we need to cut back even further. Yeah. To talk about fluid, similarly to potassium, our kidney removes fluid from our day-to-day intake. When the kidney is quite impaired, we're not able to remove all the fluid we take in. And we can see it in our body as it accumulates, as we can see a swelling of our leg, increasing our blood pressure. We can start lowering it by the amount of fluid that we accumulate, by decreasing the amount of fluid we take. But at times, when we're trying our best to restrict the amount of fluid we take in, we still have to give medications such as water pill to help our kidney release that extra burden of fluid. And the kidney is also related to our heart or our cardiovascular health. There are traditional factors such as old age, male gender, hypertension, cholesterol, diabetes, smoking, physical inactivity, menopause, and family history of cardiovascular disease or ventricular hypertrophy of the heart. For some non-traditional factors that are specifically more keen to be seen in patients with kidney diseases, such as albuminuria or protein leakage, anemias, abnormal calcium phosphate metabolism, extracellular fluid volume overload, electrolyte imbalance. These are the things that are managed and helped by the kidneys. And where they're imbalanced, these factors are often dysregulation, and it can increase the risk for cardiovascular diseases. And another question is, are my heart medications safe for my kidney? And that's a really good question. And this is the interaction between pharmacologics. Sometimes when the kidney function declines, we have to dose the medication for that kidney. Sometimes the medication for heart are very beneficial for the kidney as well. And really it becomes a personalized medication. And again, it really takes a village to really build. And we have to communicate between our cardiologist, between our colleague to see the ideal medication, the ideal trajectory for your long-term health. But to answer the question, heart medications depend on the circumstance, the dosage, the indications, and of course, monitoring. It can be both healthy for the heart and also healthy for the kidneys. Oh, I apologize. I did not go into this slide. And to do about research, in the past years, new medications and tools have been developed that help us target specific kidney diseases and prolong kidney health. In the recent years, new medications have revolutionized certain disease management. And UCLA, as a part of the research and academic center, are involved and try to produce new data and new advancements so we can provide technology and provide advancement in areas that remains challenging in the hopes that we can provide positive changes to our patient, to our healthcare system, and to provide exceptional care. And to summarize, kidney is a complex organ that works in a complex scaffold with the other organs to maintain the optimal balance. Our plan is to identify risk factors and to mitigate them to prevent the disease from developing. But when kidney disease do develop, we test and analyze the condition, provide interventions and medications, whether it's ACE inhibitors, can train the blood pressure, can train the blood glucose in patients with diabetes, and remove and restrict protein to avoid excessive protein intake. We're also trying to monitor the response to our treatment and trying to optimize and aim and delay the progression. We also have to monitor the complication that we can see, such as the anemia, malnutrition, bone diseases, and the acid accumulation. If we can delay the progression, we can delay its effect on other organs, such as for our cardiac vascular health and more other organs that are involved. But over time, or due to unfortunate circumstances, despite the best care we provide or the most optimal case, kidney disease can still progress, and we fear that the kidney function is no longer adequate to keep us safe. We have to think about the kidney, and such as how can we do in the times when the kidney is not working? We have to think about replacement of kidney function with either dialysis, with transplant. And often that is a very, very difficult conversation. I think dialysis to every patient I've interacted is a life-changing event. We can provide medications, we can do things to control, but things sometimes is out of our control. We also have to think about the humanitarian aspect. Changing your life around and dependent on a machine is not something what we think about on a day-to-day basis. And this is something that we need to approach in the conversation, not the time we need to, but plan it to foresee it and have a conversation slowly, but building up if it is what we foresee. And one of the questions that we ask is that what risk does dialysis pose to the patient? I'm scared because my family member have died on dialysis. That's a great question. Dialysis, I think it'd be best to describe it if you've ever seen somebody on dialysis. And dialysis is a modality that comes in different forms. We have what we call hemodialysis or blood dialysis, in which we take a small portion of blood from your body and we make go filter it through the machine, try to remove toxins from the blood and return it afterwards. Otherwise, we also have what we call peritoneal dialysis, in which we use dialysate or fluid instilled into the stomach and allows our stomach to extract the toxin into the fluid and then remove it. And this is what we call consider invasive. There are things that are done to our body that we are not ever designed to do so, but it allows us to accomplish our goals to remove those toxins and keep us healthy. But just as we think about removing blood from our body, there's always a risk of side effects. There's always a risk of low blood pressure, and sometimes patient just doesn't tolerate it so well. And to address your question, what are the risks in patients who have other comorbidity, such as cardiovascular diseases, heart diseases, neurological diseases? Their ability it may not be as robust as someone who is much healthier, who don't not carry these diagnoses. And they may not be able to tolerate it and develop side effects such as nausea, vomiting, discomfort, low blood pressures, and so forth. Yeah. Another question that is answered, what are the over-the-counter medication or supplements I should stay away? I think generally medications over the counter, I think ibuprofen, NSAIDs, or Aleve, long-term usage of these are have shown to cause damages to our kidney. And then herbal medications wise, there are a slew of medications are available, and they unfortunately do not describe the effect or the damages that can be on the kidney. Common medication that are being well researched, for example, herbal medication are supplements that contain stearic acid. However, we are not able to provide literature or research to really have a comprehensive idea of all the herbal medications that can do so. And I think it's important to have that discussion with your physicians prior to starting or you have started to give us an idea what you're on so we can have an idea when we interpret the blood work and the blood test. And to move on, I have already described about dialysis. But to talk about to review the modalities that are available for advanced kidney diseases. Dialysis is a mean to provide a solution of a failing kidney. And there are many ways to develop dialysis, as we described, either blood dialysis, called hemodialysis, or stomach dialysis, called peritoneal dialysis. But we can also do them at different locations, whether in a dialysis unit center, or we can do them in our home, whether home dialysis through hemodialysis or home dialysis to peritoneal dialysis. Dialysis is a mean to address the problem, but there's a cost in the quality of living. Patients have to arrange their day around to deliver dialysis, whether to drive to the dialysis unit or to arrange their home situation living to facilitate dialysis at home. And to some, based on their personal values, patients may deem dialysis is not what they envision in their future. And we have also to discuss conservative cares to help reach our patient goal. And this can be an emotional topic for patients to talk about a failing kidney, to talk about their scope of care, their goals of care, to talk about is this really the right thing for me to do? It is such a comprehensive and complex decision that we often have to do it slowly and slowly to go to the right decision, the personalized decision for the patient. Yeah. Another question that's asked is what is the difference between hemodialysis and peritoneal dialysis? So hemodialysis and peritoneal dialysis, they're just dialysis in a way it's a modality. One is using blood going through a big machine to clean the blood. And peritoneal dialysis is using our membranes within our stomach as a way to extract the toxins. Another question is, why isn't hemodialysis offered to all patients? Oh, sorry, why isn't home dialysis offered to all patients? And that's a really good question. Dialysis is an extensive and difficult process. There's a lot of teaching that's needed to teach the patient to perform at home. And sometimes patients are able to do it and they can do so safely and effectively at home. But sometimes, due to one reason or the other, it's not a safe situation to do at home, or they're not able to do it safely at home, or they prefer someone who are trained to do it for them. They have the preference to come to the in-dialysis unit for the dialysis treatment. And to be done afterwards, they can go back home and relax. And that is what it is on this dialysis. So our goal is always trying to go to home dialysis. Not only does it have improved quality of life, but it'll also have a better outcomes in terms of patient health. But sometimes it may not be the right thing to due to circumstances, but with this is what we're always trying to do, to transition to home dialysis. But what is the next stage to dialysis? If it is always within our patient's goal and we're able to, we always hope that our patient is able to transition to a kidney transplant. And sometimes we're not able to jump to it right away. Sometimes we are able to, but when the times we aren't, dialysis is seen to be is used to give us a time to bridge to a kidney transplant. And after kidney transplant, we hope that we're able to stop dialysis and go back to how we were to return the quality of life to our patients before dialysis was started. Well, to summarize, we have to be we have to be involved in our kidney to learn about of our kidney. Kidney disease can be decades, can be years, and can have a long and impactful effect on our health. As such, kidney diseases, when ill and severe, can also affect our ability to carry out daily livings. As some of you have described, when some patients on dialysis, their family member are afraid. And it is important to discuss these diagnoses and to know these diagnoses so you can share with your family member so it will not be a surprise to them. We have to be active in our care. Staying active, staying healthy, eating healthy food may seem very simple, but it does go a long, long way. A lot of our diseases can be controlled, can be mitigated early if we are able to catch it early and mitigate it to avoid these risk factors from developing and prevent onset of kidney disease. We have to ask questions. Knowledge is powerful. It gives us insights and motivation to continue our care and give an idea of why we're taking these medications and what are the effects. So when we see our lab results, when we discuss with our doctors, we know the function, we know why we're taking these blood medications. And if we need to increase our dosage or change the dosage, because give us much more awareness to why we're doing so and why we're taking these medications. Of course, we always appreciate your feedback and learn from our patients as well. So this come to our conclusion, our slide. I just want to open up and see if there's any other questions. Oh, there's a couple more. So the question is, my family has inherited kidney disease. Is there preventative nephrology or lifestyle changes I can implement to prevent the diagnosis? So that's a great question. As our research has shown, sometimes this genetic disease will cause you to develop kidney disease with time. Knowing that will allow us to refer you to our kidney specialist, and we can do diagnostic imaging. We can see if you are already developed kidney diseases. If not, we can look at your risk factors to developing kidney diseases and see if there are many medications or changes that we can implement to prevent or to slow the onset of disease. Now, that being said, there are also a myriad of genetic diseases. That doesn't mean when you have it, you will develop kidney disease. It can mean you are at increased risk factor developing kidney disease. There are patients who are these who have these risky genetics, who have normal life throughout their whole entire life without any development of kidney disease. But there are also, unfortunately, others who have that increased risk factor that predispose them. And something else, unfortunately, given the additional injury, whether it's uncontrolled diabetes or hypertension, that accelerated their kidney disease from progressing. And I think, is there any lifestyle changes? I think a healthy body is important. If you can stay healthy, stay active, exercise regularly, having a low processed food, eating healthy, I think not only will be overall helpful for your kidney, but overall will help you with your entire body, your cardiovascular health. Yeah.
Thank you, Dr. Lei. That was very informative, amazing lecture. I think there were some questions about preventative nephrology. So I think preventative nephrology is very important. I think multiple reasons. One is early detection. So Dr. Lei mentioned most of the times when kidney is injured, most people don't have any symptoms. So routine screening for annual screening, or more often for high risk patients, for someone who has diabetes, hypertension, or family history of kidney disease, um, you know, patients should be screened early. So early detection is the key. It's one of the big thing in the preventative nephrology, and also like management risk factors. Control of any diet and smoking, excess alcohol use, diabetes, high blood pressure. So if you know that you are high risk for having a kidney disease, also manageable like risk factors that we can modify, those are also very important. And then there are some medications that slow progression of a kidney disease for a certain population. So, have to talk to your primary care doctor, your nephrologist, to identify there's a lot of medication that coming out could potentially slow the progression of your kidney disease. And also, like Dr. Lay mentioned, there's a lot of complications, like, electrolyte imbalance, or like bone disease, vitamin D's, or anemia. So simple blood tests can detect a lot of those. And so those are very important, that key factor why preventive nephrology is one of the most important thing to make sure that no one becomes a severe chronic advance of the kidney disease. And also education. Everyone here is very, very valued education. That's why we're here in a patient engagement. So you get to know what your condition has and what you can do to it's you're on your like in autonomy. We're trying to make sure that empowering patient with the knowledge or everything about the kidney health. So those are the couple of key points that what preventive nephrology is about. I think there's another questions. What are medication what I need after transplant, and what are their side effects? Very good question. It really depends on what type of transplant that you had, and then it depends on the blood test. You may need a few immunosuppressant medications or more. So I can't really answer everything. So if you have any specific questions, I think email Core Kidney Health. I'm happy to looking at the individual cases and give you more guidance. And also very important, and Jim Cunningham is here, your mental health is, I would say, it's as important, if not more important, than your physical health. So I will let him give a few minutes to kind of talk about what mental health and the chronic kidney disease is about. Go ahead.
Thank you. Well, from both of the conversations that we just had, I think emotional well-being it's a huge factor wherever you're at during the diagnosis, or you're being confronted by dialysis, or you have to learn to get your health or have some structure or improve your health. I think it's all an emotional quest. And so what I attempt to do is educate people. And, obviously they have their nephrologists. And what we do is it's a collaborative kind of working with to bring people to a point where ultimately they believe and they see that they can survive this diagnosis wherever they're at it, or try to maintain your GFR for as long as you can, whether it's genetic or it's an injury, or they're hypertensive, or the whole myriad of types of things that contribute to kidney disease. I think when people can become accountable for their own health, and from a behavioral standpoint, they see that the little changes that they make by losing some weight and changing their diet and getting in shape, all of those are big, big, big kind of constructs. But once people start seeing some progress and they see their health going in the right direction, I think they see that they can survive. And that's basically what we do and what we emphasize and what we try to implement at Core Kidney. And it's it sounds easy, but it's difficult. But once you get the template, or once you get the blueprint, or once you get the structure of how to proceed, and obviously it's so specific to every individual, but there's some truisms to these conversations. So that's basically what I do as a clinician or a psychologist. I just walk alongside people and educate them as to what they need to know. Sitting in a doctor's office is one thing, but having seen somebody every day and holding them to accountability about how they're eating and how they're watching certain elements in their nutritional factors in their diet is also very important. And it's also it's kind of we come from a motivational kind of stance, and I do a lot of modalities of different types of therapies, but I think everybody has strengths in their past, so I just try to reacquaint them with that and find a support system, and yeah, it works. It works, if that makes sense.
Thank you, Jim, for your expertise. I think there are a couple of questions, Dr. Lay. Do you want to tackle those? Let's see.
Yeah. I think the first one I see is I take alpha lipoic acid for neuropathy. This is one of the acid that can be deleterious to the kidney. Thank you for bringing it up. So generally, when we talk about acid, it's that's a metabolism that we produce that we are from our protein metabolism. And generally, when we talk about alpha lipoic acid, that's I believe that's it's a supplement, and it's not in the same category. It's just how the substance is called as an acid. It is, but it is not the acid that we are referring to for patients' kidney health.
And I think, every physician might have a different recommendation. They're asking, how often should I check my blood pressure at home? What do you tell your patient, Dr. Lay?
Yeah, that's a really good question. So I think it depends if you are on medication or not on medication. So in general cases scenario, if you can take your blood pressure once a day in the correct manner, that's very important, and track it down, it'd be very good. If you're on medication, sometimes as we increase your medication, we want to see the effect of medication in the morning, in the afternoon. And once we have a steady line of consistent data, we can try to spread it out a little bit.
Yeah, I think that's I agree with it. And then I think there are a couple of tips, like, accurate blood pressure reading is also very important, because if you want to make sure that you get it right when you check your blood pressure. So make sure that you in a quiet place, relax for at least 5 to 10 minutes, and make sure that you uncross your legs, and then avoid caffeine or like extraneous exercise or smoking. I mean, you shouldn't smoke anytime, but make sure you don't, take of those caffeines or exercise 30 minutes before you check your blood pressure. And then also we recommend always upper arm blood pressure machine rather than wrist or the finger one. So the closer the machine is to your heart, it probably can check your blood pressure more accurately. Let's see. Okay, I think there are some one person asking about what are some challenges that patient can face with a kidney transplantation. I think it's a many aspect. I think emotionally, medically, also at home. In terms of the health wise, I think there's a lot of I couldn't really mention about the immunosuppressant medication, but after kidney transplantation, everyone should be on some sort of immunosuppressant. Like, Dr. Lay mentioned, every medication has a kind of side effect. So, patients sometimes, experience a side effect, severe side effect that's also very stressful, and also taking medication every day or even twice a day. A lot of anti-rejection medication are twice a day. So it could, interfere your daily life. And then also, body image, like wise, you have a surgery or like weight changes. Some of the medication have a side effect of weight gain. So a lot of patients might concern about that. And also uncertainty, and more studies coming out, but some of the patients are like, how long is it going to last in my body? So that's a big question that I hear a lot of from my patient who got kidney transplanted or any other organ transplantation. So I think the key is to connect with your healthcare provider and ask questions. And then, if there is more questions, and coming to the webinar like this, and we're always happy to answer what you have.
Thank you so much, Dr. Hwang and Dr. Lei. I really appreciate it, and I'm sure all the attendees do as well. Let's wrap up with some final announcements that I have on behalf of Core Kidney. So can we go to the next slide? Thank you so much. So before we wrap up this evening, I would like to highlight our upcoming outreach event of the year, which is the Core Kidney Patient Healthcare Provider Summit on November 1st here at UCLA. If you are interested in attending, please see to our contact information on the next slide, and also please reach out to our team. We will be hosting a myriad of different physicians, patients, diet specialists, psychotherapists, and be discussing all the topics that have been highlighted here on this flyer below, such as glomerulonephritis, cardiovascular kidney metabolic syndrome, high blood pressure, mental health, and more. Some of these topics were touched on today during our webinar, but they will be touched on in much more depth during this summit, and we would love to see you there. Next slide, please. I would also like to take a moment to highlight our annual involvement in the PKD Walk, which supports patients and families affected by polycystic kidney disease. This year's walk is going to take place on October 12th in Los Angeles. And if you're interested in attending or would like some more information about attending, please reach out to us at corekidney@mednet.ucla.edu. This email address will be sent in the chat shortly. Every year, we have members of the Bruin Beans Health Club, along with our Core Kidney faculty and staff, to accompany us on being present at this walk and walking alongside patients and their families. They host many events throughout the day, such as raffles and opportunities for patients to sign up for a clinical trial specifically is what we offer in that space. So please attend if you are available. It is a great community event in regards to kidney health advocacy specifically. Next slide, please. Furthermore, I would like to highlight a very valuable resource that helps patients and families better understand the complexities of kidney disease. This conversation, led by Dr. Eve Glazier and Dr. Anjay Rastogi, is an excellent video for anyone to learn more about their condition and the care that is available to them. The link will be sent in the chat as well. This resource is very valuable in understanding kidney disease at a much more simpler level for patients and families looking to understand their diagnosis from home, or maybe are struggling to overcome the boundaries and obstacles that come with having kidney disease and overcoming obstacles such as going through dialysis, waiting for a kidney transplant, finding a living donor, et cetera, et cetera. This is a great place to start in terms of understanding and broadening your education on the topic as well. Next slide, please. Here are many of our contact points. Please reach out to us if you have any questions or have any feedback for us about this webinar. We would love to hear from you, along with reaching out for involvement in the Patient Summit and the PKD Walk. This is where you will be pointed to as well. Next slide, please. Finally, I would like to thank you all for attending, and I would like to thank Dr. Hwang, Dr. Lei, and Dr. Cunningham for helping moderate this webinar today. It is truly an honor to hear from your expertise, and I'm sure we all left with some new knowledge that we have learned. Thank you so much.